Doctors of Reddit, what's the most outrageous self-diagnosis that you've heard from a patient? Not a doctor but a lady I nursed had an ascites, accumulation of fluid on the abdomen that gives it a hard swollen look, and she convinced all the ladies in her ward bay that she was pregnant. She would walk around rubbing her bump. Not a doctor but a midwife colleague of mine was talking to a newly pregnant client, second baby, about her first pregnancy. She said she'd had a cesarean birth with her first baby because her midwife got her fingers stuck in my fanny. Turns out she'd had an umbilical cord prolapse and her midwife was preventing cord compression while they rushed her to theater. Taught me the importance of a really thorough debrief after an unexpected outcome. Not a doc, but pediatric therapist. It's astounding the number of families I've worked with that believe their autistic child has been diagnosed autistic. Probably had a neurologist from Boston. Self-diagnosis? Maybe not, but a woman once asked me if I could find the rock of crack that she shoved in her fanny the day before when she was pulled over by the police. She wanted it back, if possible. My dad is a physician, and he's got a lot of great stories. This is from memory. If anyone is interested I can ask my dad about a few more stories, but my favorite is when a little old lady who didn't speak English came into the clinic with a live chicken. She claimed the chicken had the spirit of her dead husband in it, and it was giving her nightmares. She told the check-in desk she wanted to talk to the doctor about what to do. So my dad, the only guy who spoke Spanish at the moment in the clinic, listens to her and doesn't quite know what to do. He asks the lady if she has tried getting rid of the chicken. The lady says no, she doesn't want to get rid of the chicken. She wants to keep it alive, it's a pet. She tells my dad she wants the doctor to cleanse the chicken of her husband's spirit so he can rest in peace and so she can stop having nightmares. My dad tells her he doesn't think he has anything to fix that particular problem, and asked if she'd tried anything already. At the time he is working on a reservation in the southwest, and traditional healing practices tend to take place alongside modern medicine. She says yes, but it didn't work. That's why she went to the clinic. She said thank you and left with her chicken. TLDR. Women comes into clinic with a chicken. My dad's got a bunch more stories from his 40 odd years on medicine if anyone interested. He did his residency in Compton, CA. Exciting place for a doc. My mom before she died, her descent to death was a quick one. 15 months. March 2012. She says she's getting difficulty moving joints on her right hand and elbow. Goes to doctor. Says it's fatty tumor, sends her home. She starts tripping on the floor. Always to her right to start. She is saying she's getting weaker. Doctors do tests. MRIs. Blood work for endocrine disorders. Neuro diseases. Everything coming up clear. I look at all the data. I scour the internet. She has no history. ALS. I tell her neurologist. He says I am wrong. It can't be ALS. Why not? No good answer. Time goes on. 4 months now. She's having trouble talking. Starts writing everything. 9 months I buy her an iPad because she can't write clearly. 8 months she can't stop drooling on herself. Eating becomes difficult. 10 months she's wheelchair bound. Neurologist accuses her of faking it. 14 months she can't swallow. 15 months dead. DRs at the ICU asked me when she was dying from pneumonia. How long has she had ALS? Her neurologist said it wasn't ALS. Accused her of faking it. Scoffed when I suggested it to him. I admit ALS is an outrageous diagnosis, but it was the only thing that fit. But if a patient or family says what about X thing, don't scoff at them when they ask why not. I'm so sorry to hear about your ma. My condolences. Even if you don't want to sue, please complain to his licensing board. He should have had a reason to back up his exclusion. A previously healthy, young, working professional woman in her early 30s came to the ER saying she had a cold that's just been lingering and she couldn't get over. Said she needed some antibiotics. She was actually admitted to the hospital and just kept getting worse and worse. Pneumonia to respiratory failure, needing intubation, ventilator to ARDS to septic shock and multi-organ failure. Every possible test and study done. Running out of answers, someone decided to order an HIV test. Turns out she had full-blown AIDS and a CD4 count that was practically zero. Unfortunately did not survive. I popped a pimple on his side and chicken bones fell out. Obese, uneducated lady with her small dog featuring a gnarly granulated abscess on the side of his lower abdomen. The kicker? She wasn't lying. Hernia present that allowed chicken bones to perforate through small intestine directly into subcutaneous space. I mean, isn't that like rule 1 of owning a dog? 1. No chicken bones or chocolate. 2. Make sure to feed them and give them water. Doctor here. One story that sticks out is a woman who was convinced that she had Helicobacter pylori, bacteria that causes stomach ulcers in some, and had to be tested. I reviewed her chart and it showed multiple negative tests over the years and even a biopsy sample from an upper GI scope that was negative. Her treatment for this infection was to eat dirt. Literally dirt from the internet advertised to cure stomach issues. There was no convincing her that this wasn't a thing. This is a tame one, but the others are too specific to tell without the possibility of revealing the patient's identity. Slightly different. In my teens, me and some mates are walking along, totally stoned. This old lady in front of us trips up and smashes her face on the ground. Blood is pouring everywhere. Being the lovely boys we are, we lift her up and thankfully we're informed that there is a GP practice only 100 meters away. After the incredibly slow walk arm in arm to this place, we walk in and just as I am about to shout we have an emergency, the little old lady, whose clothes are now covered in blood, politely requests I've come to collect my prescription. Not a doctor, was the patient. A few years ago, during the summer, I started to get really sick. Fever, itchy sore throat, cough with mucus. Went to urgent care after my throat began to swell. The doctors tested for strep. Test was negative. They insisted it was mono. Tested for mono. Test was negative. Yet they kept insisting it was mono. Doctors gave me steroids and sent me home. Over the next 2 weeks the symptoms became worse. At this point, the pain of swelling was so bad, all I did was sleep and drink water chicken broth. Belly. My throat was so swollen I couldn't swallow anything solid. One morning I get up and my throat is completely swollen to the point I can't even swallow my own saliva. I have a panic attack and call urgent care. They tell me time coming right away. I go back and the doctor doesn't even look at my throat. Insists it's mono. So, my BF, X, freaks out and demands she look. She does finally and gets really nervous. Tells me to go to the ER immediately and they would be waiting for my arrival. Turns out my tonsils are abscess, about to burst, and I have tonsillitis. Worst crap ever. Not a doctor, but I went to the ER, post DVT, with symptoms of a pulmonary embolism. I had chest pains, could not catch my breath, and I passed out in the waiting room. Even though I had oxygen sats below 80% and was clearly struggling for air, the doctor actually patted my hand and told me I must be stressed and tried to discharge me. I told him I refused to leave and he needed to check with my PCP before he did anything else. I ended up staying in the hospital for 4 days and eventually they found a small clot in my lungs. I still couldn't walk very far without stopping by the time they discharged me. I'm trying to see if my doctor is in here. Last week I was thoroughly convinced I had cancer in my neck and shoulder because I felt 2 hard masses. I just knew it had to be cancer. Doc looks at it and then slings me up and said the damage has been done. You just need to let it heal. And I was of course confused. I had apparently damaged my muscle and it had formed 2 pinto bean sized knots. He was right though. Knots are starting to go away. Dr. Rob, you're in here. I admit it. You were right and I was wrong. For a second I thought that you were convinced your shoulder blades were cancer. People blaming vaccines for all sorts of illnesses, ranging from congenital mental handicaps, children's behavioral problems to cancer, autoimmune diseases, senile dementia and so on. Most of the comments here are funny or eccentric anecdotes that happen once in a while. But there are shitloads of patients that every day claim that their grandpa died of heart attack at the callow age of 96 because of the effin' flu shot that the family doctor prescribed. He was fine before getting it, 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 getting it. I love how there are no comments on this response because no one wants to touch the vaccine conversation for fear of opening a hole in the space-time continuum. Well, I'm not a doctor, but I am an EMT. I stepped into a house in the projects to hear, "God damn it, I am having a heart attack." I know what a heart attack feels like, Lorraine. There was a lot of feces and urine involved, but no cardiac issues. This was actually a dialogue between two obese black women in NJ. The one screaming was calling the other one baby from time to time. So lesbians? I don't know. She demanded that the paramedics come, so I kind of just waited in that cesspool of a bedroom discreetly watching the Nat Geo special on water bison that was playing on her giant TV. My sister keeps diagnosing me with endometriosis and polycystic ovaries and another one I can't remember. She gets furious with me for not going to the doctor because I don't care about my health and I am sticking my head in the sand etc etc. My only symptom is irregular periods and normal cramps, fatigue while on my period. But apparently cramps aren't normal and neither is wanting to eat chocolate and take a nap. It's gotten to the point where I literally cannot say a single word about my health in any way, shape or form without her jumping on my butt. And no, she's not a doctor. She does have endo and cos, which apparently qualifies her to diagnose me. Not my patient but my dad's. In the early 70s, a guy walks in claiming that he has colon cancer and is really worried. He had a history of coming in repeatedly to the clinic for various ailments. Dad checked him out and saw no problems. Sent him back with a scheduled review. The patient still had the same worries and stuck with his claim that he had colon cancer. Dad told Hi, "If you want, I'll give you in writing that you don't have this. Can you imagine that today? P. And if you do, I'll take care of you." The patient stopped coming to the clinic with the complaint, but he and Dad became really good friends. 40 years later he is still a hypochondriac, and Dad still reassures him. My best friend had weird symptoms for a while and became obsessed with googling and researching the possible causes. She was convinced that she had multiple sclerosis. She woke up one morning and the lower half of her right side was numb. She went to an emergency care and asked for an MRI. The doctor there believed she had sciatica pain and refused. Weeks went by and she went to another urgent care and was finally referred for an MRI. Turns out she had very advanced MIS, now is partially paralyzed. Nobody really wants to be responsible for their obesity, so people Google diseases that could be causing them to gain weight. My favorite was a lady who insisted that she had Cushing's disease, what people mean when they say have a glandular issue. It's obvious that she wasn't. It's rare and there are some classic signs that normal obese people don't have. So I went through an exercise where we discuss all the food that she ate during a typical day. We hit roughly 3,000 calories before finishing what she typically eats for lunch. The conversation never goes well from there. There is nothing that I can prescribe for denial. 4th year med student here, so I don't have the MD title yet. But during my pain management rotation I had a patient tell me that he had Hep C. And when I asked how he got it and when he was DX, he told me a doctor on 4chan diagnosed him a few months back after his friend told him he got cancer from too much internet usage. I crap you not. It took me all the power of God not to bust out laughing. But then he continued to go on how he's helped his friends out with medical advice on 4chan and how he doesn't trust WebMD or Google for medical advice, because they are owned by the man and only good at making people believe they have hypochondriasis. So long story short, he didn't get the oxycodone he was hoping to get from this consultation and made a giant fuss how we're only making his Hep C worse by not giving him meds. For those asking, DX equals diagnosis diagnosed. Oh man, I feel sorry for you. I had to spend an unfortunate amount of time in the ER and at my GP's office for a problem that presents mostly as pain. I never truly appreciated just how big a problem drug seekers are until dealing with pain management people. That entire specialty, from the outside, seems to have the patience of saints. Vet tech assistant. I work overnights and usually I clean, just check vitals on patients, and answer phones. I pick up a call at about 2:30 in the morning. This woman is convinced her dog has bloat. While that sounds benign, there's one kind of bloat where the stomach twists and cuts off circulation of blood from the stomach. It is deadly if not caught quickly. There's other kinds that are treatable, but when you look up dog bloat, you're going to find the killer one first. I ask her what makes her think her dog has bloat. She tells me her dog ate a piece of steak and started acting more sleepy and his stomach was a little bloated. She looked that up on PetWebMD and it told her that her dog had bloat. I go through the symptoms of GDV, the killer bloat, and she says no to all of them except the bloated stomach. I give her the price to get an emergency exam. She suddenly stops freaking out, thinks it's not a big deal and hangs up. She never came in for an exam. 4th year medical student here on my psychiatry rotation. Last year we had a guy with delusional disorder who was completely normal to talk to, just a little quiet with the exception that he was certain his sister's kids were his, because he ovulated and bore the children himself. I once went to the hospital because I thought I had a collapsed lung. Turns out I was just super hungover and my ribs hurt from throwing up all night. Very embarrassing and expensive. I was the one that self-diagnosed. I'd been unwell for years and the GP kept telling me it was I'd be fine. Well, my mum was told to check out celiac disease for her issues and it wasn't, but my symptoms fit. So off to the GP I go. I have these symptoms, they fit and I'd like to have the blood test. They refused. Said I was too fat for celiac and it just ibs. I cried from frustration and apparently that guilted them into saying okay, have the test. I did and yes, I have celiac disease. And yes, you can be fat and have it. Spend 5 minutes on WebMD searching your symptom and conclude you have cancer with 3 weeks to live. Hypochondriacs everywhere. Physiotherapist here. I had someone come into the clinic and ask to buy exercise bands to do rehab for his shoulder, but didn't want to come in for an assessment first because he already knew what was wrong. When I asked him, he told me that he tore his labia. I didn't correct him. He meant labrum. One time I had this bad rash that wouldn't go away. I went to the dermatologist and he told me it was contact dermatitis and I needed to switch out my laundry detergent and toothpaste and stuff. I did that and it got worse. So they did this whole allergy panel on me. Nothing. They told me it must just be a reaction to something, so they gave me a prescription steroid cream to relieve it. Well, then it got way freaking worse. It became dark red and itched like a mother. I started to notice a dark ring shape to it. I went to a different dermatologist and she cut out a piece of it and sent it to the lab. Turns out it was some unknown fungus I picked up in the jungle in Costa Rica. I had to go through some hardcore antifungal regimen, but that eventually fixed it. I was suffering for probably 2 months. Contact dermatitis my butt. I like to think though that I had a little fairy ring growing on my arm. Vet student here. We once had a couple who waited about 12 hours after their 4-week-old kitten fell off the balcony because the kitten was tired and needed rest. It sadly took them too long and we couldn't help the poor cat anymore. I am a nurse in the ICU at a major teaching center and I had a patient's dog to tell me her dad is allergic to potassium because she was. At this point I am trying to keep a straight face and not laugh. I asked her why she thought she was allergic to potassium and she explained she had a bad reaction last time she was in the hospital. I asked if the reaction was pain at the IV site and she said yes. I tried to explain that everyone has this reaction and it is not an allergy. I then told her dad was not allergic and that it is not possible to be allergic to potassium since we require it to live. She then keeps going on and says she doesn't want her dad to get any because of her reaction. At this point I am losing patience with her and tell her that her dad is fine as has been receiving potassium with no reaction. She starts yelling and demanding to speak to the intensivist, only no residents. So I go get the intensivist just to try to calm her down. He comes and tells her everything I said is true and he doesn't have time for her voodoo crap, so she needs to calm down and let us care for her dad who is on life support. Not a doctor here, but a patient who feels some sort of self-diagnosis is helpful, especially if of a young age. I was constantly at the doctor's over a period of 2 years with bleeding from the rectum and constant abdominal cramps. Because I was only 18, I was told it was women's troubles. They refused to look at my bowels because of this and I even had a doctor roll their eyes at me for questioning otherwise. Fast forward a year and I fall really ill, with bad diarrhea and the cramps and bleeding still. 3 A&E trips and I was told it was just gastroenteritis. Finally, when it didn't stop, they did keyhole surgery to remove my appendix thinking it was appendicitis. It wasn't. 2 weeks in hospital, And finally I got a last minute scan which told them my colon was deteriorating. They removed my large intestine and gave me a stoma, where your small intestine is pulled to the outside of your abdomen and waste is collected in an ostomy bag. I was also told my colon was just half an hour from perforating and I would have died without the emergency surgery. Finally, I was diagnosed with ulcerative colitis, a form of inflammatory bowel disease. Since the operation, I have had a reversal, where the small intestine is stretched to the rectum to allow me to go to the toilet normally, but I now live on a lot of medication. I'm often having to take time off work due to only having diarrhea and having it around 6-8 times a day despite all the pills I have to take to manage it. Also get a lot of bleeding, cramps and still can get UC in the rectum which may lead to more major surgery. Had to have Botox in the rectum to make going to the toilet less painful and just last week was in hospital with a suspected intestinal blockage. I'm only 21. This could have been prevented if my age and complaints had been taken seriously, as if my colon hadn't been as bad as it was, which had happened over time, it would have been medicated. Not a doctor, but a woman came in claiming her foul odor was from a leftover condom in her nether regions from 2 weeks prior. Needless to say there was no condom down there, just some fungi, even more unusual. She must have been with a pretty fun guy. I'm a medical student, and this is from when I worked in an ER. It's not really a ridiculous self-diagnosis, but it was pretty funny. The doctor I worked with walked into the room after the nurse was finished and this lady immediately told him she had a problem with her gallbladder. She started listing off all the symptoms she had, which read like a textbook's description of gallbladder pain. Finally, he asked her to point to where she felt the pain, and she confidently pointed to her left upper abdomen and said, "Right here. The gallbladder is on the right side." Her husband thought it was hilarious. To be fair, I had gallstones, verified via ultrasound, and a chronically inflamed gallbladder, as per my surgeon, and all my pain was in the center, just below my ribs. 5 doctors missed it. Due to where my pain was, my GP only ordered the ultrasound after my Milhon was a nurse suggested it. Upper right side was sore after they took my gallbladder out. It put up a fight apparently. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.